Thomas, and today the subject of discussion is sleep hygiene and institutional anxiety. The discussion will be addressed from a college mental health perspective, with me framing sleep hygiene as a campus public health issue. What if I told you that college institutions are the architects of sleep hygiene? Up to 2/3 of college students report sleep problems with impaired academic and mental health functioning. Today, we will discuss briefly target population, clarify some key terms, outline the problem, explore contributing factors, examine relevant theories, introduce the sleep smart intervention, and address evaluation and ethical considerations. Sleep hygiene is a behavioral and environmental practice that supports sufficient, regular, restorative sleep, consistent timing, limiting stimulants and screens, cool room, dark, quiet environment, regular activity. These are the things that define sleep hygiene. Institutional anxiety refers to the chronic stress students experience due to systemic pressures with academic environments. Things like rigid academic structures, unclear and overwhelming expectations, competitive culture, lack of mental health support, and housing issues, as well as financial and bureaucratic hurdles. The population we're discussing today consists of college undergraduates aged 18 to 24, living on campus in residence halls, racially and ethnically diverse, with multiple gender identities. The public health problem is that up to 2/3 of college students experience sleep issues that adversely affect their academic performance and mental health. Hirschner and Chevron reviewed multiple studies showing that sleeplessness and poor sleep hygiene are highly prevalent among college populations and are associated with increased risk of depression, anxiety, substance abuse, impaired immune function, accidents, and lower GPAs. Campus calendars reward all-nighters. Our students pay for it with their minds. At 2 a.m., the campus is quiet only because sleep was outsourced to caffeine. Activity shifts, late-night work moves from communal spaces to solitary or low-profile spots, making the campus seem quieter. When institutions measure productivity more than rest, exhaustion becomes a campus requirement. Students log into class with laptops open and sleep closed. They're taught time management, but their schedules prevent them from sleeping. If sleep were graded, most of our institutions would be failing at every turn. The clinic's waiting rooms are full, not because students can't cope, but because the system won't let them rest. Institutional policies and campus culture normalize sleep loss and amplify anxiety among students. This presentation examines evidence for that link and discloses campus-level interventions to restore sleep as a public health priority. Population-level survey data and cross-sectional campus studies show increases in mental health difficulties experienced by college students over time. This young man showing up in class in his pajamas might seem funny, but it's not. Pajamas in his case and slippers aren't just comfy cozies. They're survival gear. Risk factors and social determinants are amplified by institutional norms and social constraints. Why address the problem? Late adolescence and young adulthood. These are formative years where lifelong habits and mental health trajectories can take a really bad turn for these college students. Population level impacts Improved sleep enhances academic performance, mood, and retention. Population level declines harm academic and mental health outcomes, and the consequences span mental health, academics, and long-term chronic disease. It's cost-effective to identify these issues in a preventative intervention so that they can be reduced and clinical demands and dropout rates can also be reduced. Look at some of these key statistics and look at the top 3 stressors: academic, financial, and future uncertainty. Who wouldn't worry about those things? Mechanisms of sleep hygiene and institutional anxiety. When we talk about pathways, we have hyperarousal. This activity disrupts sleep onset. Also, there are behavioral cascades that increase anxiety-driven behaviors, and these create bidirectional forces that really worsen the level of anxiety. There's group vulnerability. First generation students, students of color, low income students. These are all vulnerable factors that make some populations more vulnerable. Let's take a look at the causal pathway, the feedback loop. These may unintentionally worsen disparities. Early morning requirements, housing placement, structural changes alongside individual level interventions to achieve health equity. The sustained pressure can lead to anxiety disorders, depression, and burnout. These mental health challenges may disrupt sleep patterns, exacerbating the cycle of stress and poor sleep. Health equity challenges also create issues, as well as marginalized students who may disproportionately experience sleep disruptions and disturbance. There are many theoretical frameworks that address intervention frameworks that address intervention for sleep hygiene. Here are a few. The importance of sleep interventions. Sleep-focused interventions are vital to helping students maintain healthy sleep habits for better mental health and academic success. What's common in student-focused sleep hygiene programs? The use of cognitive behavioral therapy for insomnia, social cognitive theory for modeling self-efficacy, efficacy, and peer influence, and theory of planned behavior for intention and belief-based targeting. Health action process approach is another theory for planning and self-regulation. Resources suggest that 2 to 3 well-matched theories are used and that there not be a theoretical buffet. Practical implications for campus sleep interventions for sleep hygiene are SCT to design institutional level or group interventions, CBT when delivering individual or small group clinical treatment to students, and combining SCT-informed delivery along with CBT content often increases reach and durability. Proposed intervention incorporates a project called Sleep Smart. Sleep Smart is an educational program. It has several components attached to it. Digital micro-learning, which involves workshops and using HBM to increase perceived benefits and provide cues to action. There's peer-led CBT groups and SCT-based modeling to build self-efficacy and rehearsal of sleep behaviors. Brief stress management and rumination reduction training. Policy advocacy for flexible schedule pilots and designated quiet housing. And it's a low-cost sleep toolkits that they have for referral pathways to campus sleep and mental health clinics if needed. These are included as an orientation package. I would suggest that they be included as an orientation package. In conclusion, sleep hygiene is not just an institutional issue. It is a public health issue that has to be addressed at population level to treat beyond individual sleep disorders. Interventions have to address the individual and the institutional drivers. And institutions have to provide essential resource support for managing student stress and mental well-being through professional support and promote and encourage resource utilization. Combining theories helps address both individual level factors and social environmental influences. Improving student sleep hygiene is important. Education increases awareness but has little lasting impact. CBT-informed techniques involve self-monitoring and peer diffusion to show stronger and sustained results. Sleep hygiene is vital in supporting college students' mental health amid institutional anxiety. By understanding the links between sleep and well-being and applying effective strategies, students can enhance both their sleep quality and overall college experience. Sleep well.